Hi, my name is Manuel Cruz Carrasco. I'm going to read chapters 26 and 27 of the textbook Professional English Use in Medicine. Chapter 26 is Nervous System 1 and chapter 27 is Nervous System 2. I'm going to begin reading chapter 26, the Nervous System 1. A. Sensory loss. The central nervous system controls the sensory and motor functions of the body. Diseases of this system therefore lead to loss of some of these functions. Function: hearing, loss, deafness. Other symptoms: buzzing or ringing in the ear. Tinnitus. Function: sight, loss, blindness. Other symptoms: double vision, diplopia, blurring, loss of visual acuity, clarity of vision. Function: sensation, feeling, loss, numbness, anesthesia. Other symptoms: tingling or pins and needles, paresthesia. Function: balance, loss, unsteadiness, ataxia. Other symptoms: dizziness, vertigo. Note: there are no common words for loss of or conditions relating to taste and smell. B. Motor loss. Motor loss symptoms and signs include weakness, loss of power, paralysis, complete loss of power, tremor, involuntary rhythmic movement, especially of the hands, abnormal gait, unusual manner of walking. Speech may also be affected, for example, with hoarseness. A raw, deep voice, as in vocal cord paralysis. Slurred speech means poor articulation, as in cerebellar disease. C. Loss of consciousness. Patients may describe sudden loss of consciousness in a number of ways. I passed out, I had a blackout, I fainted. I had a fit, I had a seizure, I had a convulsion. Fit, seizure, and convulsion are used to refer to violent involuntary movements, as in epilepsy. Doctors may say, "When did you lose consciousness?" Here is a passage from a textbook on the causes of loss of consciousness. The principal differential diagnosis is between an epileptic fit and syncopal attack or fainting. Syncope is a sudden loss of consciousness due to temporary failure of the cerebral circulation. Syncope is distinguished from a seizure principally by the circumstances in which the event occurs. For example, syncope usually occurs while standing, under situations of severe stress or in association with an arrhythmia. Sometimes a convulsion and urinary incontinence, loss of control of the bladder, occur even in a syncopal attack. Thus, neither of these is specific for an epileptic attack. The key is to establish the presence or absence of prodromal symptoms, or symptoms that occur immediately before the attack. Syncopal episodes are usually preceded by symptoms of dizziness and lightheadedness. In epilepsy, people may get a warning known as an aura that an attack is going to happen. Note: the noun convulsion is often used in plural form. He had convulsions as a child. Now I'm going to read the exercises of chapter 26, Nervous System 1. 26.1. Complete the table with words from A, B, and C opposite. Adjective: blind. Noun: blindness. Adjective: conscious. Noun: consciousness. Adjective: deaf. Noun: deafness. Adjective: dizzy. Noun: dizziness. Adjective: numb. Noun: numbness. Adjective: lightheaded. Noun: lightheadedness. Adjective: unsteady. Noun: unsteadiness. 26.2. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Now I'm going to read the words in these two boxes. Sorry for the video being mirrored. Box 1. Double, epileptic, prodromal, syncopal, urinary, visual. Second box. Acuity, attack, incontinence, symptom, vision, fit. Now I'm going to make the word combinations. Double vision, visual acuity, epileptic fit, prodromal symptom, syncopal attack, urinary incontinence. 26.3. A doctor is trying to determine the cause of loss of consciousness in a 52-year-old man. Complete the doctor's questions. Look at C opposite and at the table in 26.1 above to help you. Did you lose consciousness suddenly or gradually? Did you get warning of the attack? What were you doing before you passed out? Were you worried or under any stress at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any involuntary movements while you were unconscious? So that was chapter 26, the nervous system 1. Now I'm going to begin reading the theory exercises of chapter 27, the nervous system 2. A. The motor system. Examination of the motor system should include assessment of the following: muscle bulk, amount of muscle tissue. Look for signs of wasting, muscle atrophy. Muscle tone, amount of tension in a muscle when it is relaxed. Tone can be increased spasticity or decreased flaccidity. Muscle power, strength. Coordination, the ability to use several muscles at the same time to perform complex actions. Gait, the manner of walking. Reflexes, you can see B below. Involuntary movements, for example, a tic or a tremor. Here is an extract from a case report about a patient with a tremor. Case 80. On examination, her face showed little or no expression. There was a tremor affecting mainly her right hand. She had generally increased muscle tone. Power, reflexes, coordination, and sensation were within normal limits. Examination of her gait showed that she was slow to start walking and had difficulty stopping and turning. B. Tendon reflexes. Examination of the nervous system normally includes testing the tendon reflexes, for example, the knee jerks, with a tendon hammer, also known as a reflex hammer. The reflexes may be absent, 0, diminished, minus, normal, plus, or brisk, 3 plus. The plantar reflexes are also checked. The normal plantar response is a downgoing movement, plantar reflection, of the big toe. An upgoing toe extensor of Babinski response is abnormal. This is when the toe goes up. Here we have a photo of a testing of the tendon reflexes with a tendon hammer. Testing the knee jerk with a tendon hammer. C. Coma. Coma is an unconsciousness with a reduced response to external stimuli. Doctors say the patient is in a coma. The patient is comatose. The Glasgow Coma Scale GCS score is calculated as follows: eye opening, spontaneous 4, to speech 3, to pain 2, numb 1. Verbal response, oriented 5, confused 4, inappropriate 3, incomprehensible 2, numb 1. Motor response, obeys 6, localizes 5, withdraws 4, flexion 3, extension 2, numb 1. Now I'm going to read the exercises of chapter 27, the nervous system 2. 27.1. Complete the table with words from A and B opposite. Noun, accents, adjective, accent. Noun, diminution, adjective, diminish. Noun, flaccidity, adjective, flaccid. Noun, spasticity, adjective, spastic. Noun, wasting, adjective, wasted. 27.2. A doctor is giving instructions to a patient during examination of the motor system. Identify what the doctor is assessing in each case. Look at A opposite to help you. 1. I would like you to relax. I'm just going to move your arm up and down. He is assessing muscle tone. 2. Can I see your hands? The doctor is assessing involuntary movements. 3. Now I'm going to straighten your arm out. Try to stop me. He's assessing muscle power. 4. Can you touch my finger with yours and then touch your nose? Good. Now do it again with your eyes closed. The doctor is testing our assessing coordination. 27.3. Complete the sentences. Look at A, B, and C opposite, and at the table in 27.1 above to help you. 1. A flaccid hand droops limply to form a right angle with the wrist. 2. British reflexes are reflexes that are stronger than normal. 3. Muscle atrophy means the muscle is reduced in bulk. 4. A tic is a form of involuntary movement. 5. A key is often used to test the motor response. 6. His coordination was poor. He could not perform rapid alternating movements. 7. A tendon hammer is used to detect reflexes. 8. When something is diminished, it is less than normal. 27.4. A patient is brought to accident and emergency in coma. When her name is spoken, she opens her eyes, but she does not answer questions or obey instructions. What is her Glasgow Coma Scale score? Here we have a photo of a plantar reflex test or assessment. The patient in coma, in the case of 27.4, in eye opening is a 3. She responds to a speech. In verbal response, she is a 1. She has no verbal response. In motor response, she is a 1, no, again, because she does not obey any instruction. So those were chapters 26 and 27 of the textbook Professional English Using Medicine. Chapter 26 was the nervous system 1, and chapter 27 was the nervous system 2. So that was the reading of the theory and exercises of these 2 chapters. Thank you very much for your attention, and that was the video.